So what we're going to do is share with you some very, I'm going to call it very pressing data. And this is a result of about 2 billion data points from around the world. That's right. That's right. So it's a little larger than the Rock Health and the CB Insights data. That's one. Two, we're going to share with you where the money is coming from. In the data deck, when you get it, we're going to show you some of the top investors in the United States and around the world who are focused on digital health. So if they're not on your radar screen, these are venture firms that you should be tracking. And then we're going to share with you some key insights about what the data never tell you and where we think you really should be focusing. I'll just say one thing. Many years ago, I wrote, and I still believe, I don't know how you feel, Ritesh, that the enterprises that would end up dominating most of this conversation would be Microsoft, Oracle, Amazon, Epic. Obviously, Box is going to be a player here, of course. Did I miss anybody? Salesforce, right. So a lot of the non-traditional players you'd usually not hear.
There you go.
A lot of the non-traditional players that you're not going to usually hear from this part of the room, we're going to talk about, because I think there's an obsession about, staying within the health zone. And the reality is, how many of you know Sally Ann Field? Raise your hand.
Sally Ann Field? Not Sally Field, the actress.
So she's from Microsoft, and she has some startups there. Yeah. If you don't know people like that, then I think you're going to be left out of the system. So before you start diving in and thinking through and making contacts and speaking with people, always great. I'm going to recommend you sort of take a step back and analyze this. What wasn't covered in my background was I have been a CEO of a $1 billion company. I spent a number of years in private equity, a $10 billion fund. And so I tend to look at these things not just from the perspective of someone in business, but from someone who was sat at the other end of the table and smiled at you for about 2 hours and asked you all sorts of interesting questions. And you were certain that we were going to make a move. And all I was doing really is training to do due diligence at your expense. So during the course of the day, I'll be here all day. Feel free to stop and ask me questions about technique. Ritesh I'm thrilled that he's here. He's actually, at my request, delayed a flight. You're on your way to Barcelona to the big digital health meeting in Barcelona.
Health Tech Forward.
Right, yeah. Health Tech Forward. So we have Ritesh for this session. I'm going to spend a little bit of time actually interviewing Ritesh. In the meantime, I'm going to hit a few buttons here and share with you.
Down there. There you go.
Ready?
Yeah.
So this takes a look at the digital health ventures in the United States. You can get all these slides. We're going to give them to you.
The other thing is these slides were taken from a 120-page report that we've created, which is the end of 2024 State of Digital Health Investment globally. It takes every market apart across the world.
Yeah. Don't pay any attention to 2021. It's a complete irrational anomaly. Just look at the deck as it is.
Yeah, but 21 was good. You could create a two-slide deck and raise $10 million, right?
That's absolutely true. And I think a lot of the people here are kind of living off that glory day, which is really, you see that as the rise. I actually see that as the fall. Where people felt very burnt. You felt if you weren't in digital health, you were going to miss out as an investor. So you threw ecstatic money into the pot. You didn't see a return on investment, and then you decided to focus elsewhere. Don't focus in on this at all in that regard. If you really take a look at the first 3 quarters of 2024, it's about trending from the same as 2023. I think that the digital health category is kind of leveraged out at this point. That's still, by the way, about $500 million of investment that you're chasing after.
But the interesting thing here, go back, sorry, Gil, for a moment. If you look, 2018, 13 billion with an average deal size of $18 million. But if you can look at 24, the same number, the deal sizes are larger. It goes to Bill's point
fewer
Series A, less seed, less early stage, more on the back end of A, B, and C.
This is where it started to get interesting. And this is for people who are really aligning, as Bill talked about, to the pharmaceutical industry, to the sense of being augmented or complementary care. I would watch this if you're going to touch base with the pharmaceutical industry. These are the therapeutic categories that they're kind of interested in if you're not dealing with operational or clinical trial recruitment issues. This is where I think it starts to get even more interesting, is the breakdown. So we tend to talk about pharmaceutical industry. It's really about life sciences altogether, medical devices and so forth. And again, you can grab all this data from us, and neither Ritesh and I can go into much deeper detail for you. By the way, we're just doing this to make sure that you're successful. We're not selling the data or anything like that. We actually franchise it, license it, and we're just sort of letting you take a ride on our backs here. Noteworthy upcoming ventures. What I always recommend, what I used to do in private equity, is I studied other people's ventures. I took a look at the trends of why they were investing. If Bill and Merck are making an investment in a particular category and those companies are disclosing the investment, study that super carefully. I mean, these are really bright people. Merck doesn't throw around money for the hell of it. If it's making an investment, it's making an investment for a very good reason. Understand why.
The only thing here I would say also is you can see it's all Series A primarily, and they're platform plays. All of these companies have a specific platform. If you look at, go back. Yeah, I like going back and forth quite a lot. So Hippocratic, digital front door, avatars, platform for like 7 different use cases. Fabric's doing the same thing with a digital front door. So you're seeing these back-end, big platform kind of investments happening now as well, as opposed to point solutions, which is quite interesting as well.
Just take note, if these companies aren't on your radar screen, start to study them. When you look at the market leaders, you can learn a tremendous amount in terms of their approach.
And we had to include Merck on there.
Right? Merck. Now, I sort of look at this. This is where I started to look at the rise and the fall and the rebirth, which was the shift from what we saw in pre-2021, where everybody was doing some form of digital app that was going to help you manage your healthcare better. And
the GP, remember that?
Yeah. And you're going to wear it, you're going to hold it, you're going to do something with it. No, you weren't. And they all pretty much started to tank. Then everybody started to say, well, what can I do with complementary care? How can I add some sort of digital support tool to a therapeutic to make sure that you optimize the therapy? That's becoming still a very hot area. The third area that I think is becoming particularly hot, and I'm going to give a pre-obit. I don't know how you feel about this, Ritesh. A pre-obit.
Oh, wow, okay.
Okay. This is
You want to make that?
I'm not a futurist, by the way. I look at predictive models. The industry is moving toward efficiency. So everybody's coming up with an AI, ChatGPT, LLM type tools that make the health system more efficient. And so that they're going around to different hospitals and they're selling in those technologies. And that's become the hot way to survive and use this. But this is a little bit like being a laptop salesperson and just saying, I'm in the laptop business and I'm going to sell you a new laptop that's slightly faster and better, and you're going to love laptops. Well, the reality is AI, which I call augmented implementation, not artificial intelligence. No intelligence is artificial. It's derived from an organic source. So it's designed to actually improve the implementation of the system. The system is constantly looking for this, but the reality is it's going to become ubiquitous. And a lot of these companies that are doing that don't realize that the sales cycle is very long. Very long. And we have a friend who was head of a hospital system downstate. Is that correct? Yeah, major medical system in New York City is going to tell you, I think it's about 1.5 years. Longer? Oh,
Probably 3 years.
Okay, 3 years. If you're going that route, think it through really closely. And again, back to my predictive model, who's going to really dominate that at the end of the day in about 2 years, 3 years? Microsoft, Oracle, right, Salesforce, they're really going to be the players there. They're just looking at how this market develops right now. For those of you in that category, you're doing their market research for them. I don't know how you feel about that. Yes, no?
Yeah. I mean, if you look at the ambient space, right? I mean, all health systems are now looking at ambient technology to make physicians more efficient operationally. Used to be 2 or 3 players. It's all consolidated now with Microsoft.
What I will say is what's really important, there's 3 different buckets that you're looking at. One is therapeutic optimization. That's very important to companies. Then it's actually acceleration. Acceleration is a very important part of the clinical research process, and many biopharmaceutical companies are looking at the practical how you use information and different types of tools in order to accelerate clinical trial, both the finding of the process and the recruitment process. That's going to continue to be a hot area, right? Digitizing the process, or to quote Ritesh Patel, if it moves, digitize it.
Yeah.
So if you're in that part of the business, there's some hope. And then there's that last part, which is how do I make the hospital system more effective through AI or ChatGPT or transliteration services and so forth. I personally find it very hard to believe, though I can be proven wrong, that small startups are really going to dominate there. I do think that the big, trusted, integrated players that already dominate the IT infrastructure of health systems are going to be the players there. And again, I'm getting the nod from the man. Speak to him.
Well, we saw the latest version of Cerner's EHR that's going to be rolled out at the end of probably Q1 of next year. It's a complete revolution in the way they're doing this, included in the workflow, completely integrated large language models, completely integrated with remote monitoring and patient monitoring. So it's all integrated in the workflow. So if a point solution arrives, it's going to be really difficult to take away the workflow solution that's already in place that people are using.
So we're going to sign off now. I'm going to be here all day to ask questions. I'm going to give you one great piece of advice. A lot of the conversation, a lot of what I hear is you're here to raise money, or you're looking to raise money. Absolutely. Raise money. My advice, look at accelerators and incubators really closely as the Ivy League. So many of you are running after money. I'd run after Stanford, Northwell,
Yale, Cornell, Tech.
All of those, Sheba Medical Centers, ARC, all of those, they have incubators and accelerators. How many of you are actually knocking on their doors right now to get advice or become part of their incubator accelerator unit? One. Trust me, it's a little bit like Johnson & Johnson and Merck. JLabs. If you worked at Johnson & Johnson or Merck or Sanofi or some great biopharmaceutical company in your career and you knock on the door for your next gig, what's the chances of getting a great job after J&J? Very good, right? If you're in Stanford's incubator, trust me, VCs are going to take a very close look at you. So I think that you're bypassing the educational system. You're running out with your idea. You're looking for money. It's a very complex web out there. The healthcare system is very fragmented. It's a myriad of sellers. If you have figured out how to navigate that fragmentation, it's going to be a long haul up. Ritesh, final word to you.
I would say, to your point, Gil, the recent announcement by Aegis of creating venture studios with the academic health centers just goes to show that there are some avenues other than just traditional. Most everybody's still not doing anything related to early stage. It's all Series A and B at the moment still. But the big providers are now creating funds and innovation hubs. The payers are creating funds and innovation hubs. So I think that's where the opportunity is. And yes, if it moves, digitize it. Thank you. Thanks, everyone.